Welcome back to more virtual Lowcountry Live. And so many businesses are closed right now as we shelter in place, but the important ones, the ones that we need right now, are still open. And with that said, I'd like to welcome our next guest, and that's from Charleston Oral and Facial Surgery. We have Dr. Erin Sarathy. Good to see you, doctor. You have services that people still need right now. So welcome to the show.
Thank you. Thank you for having us. We want to just extend a quick thank you for all the frontline healthcare workers that are staffing our emergency rooms and our urgent care facilities right now. We've tried to keep the doors open at Charleston Oral and Facial Surgery because we found ourselves in a very unique position to offer care for oral surgery related emergencies. And really it's to help lessen the burden on our emergency rooms and our urgent care facilities around the community. It's basically our way of helping out our community during this trying period.
Right. So you are still open for emergency services right now. And what type of assurances are you offering people who still might be, nervous about going in with the spread of coronavirus? Like, what are you doing? What steps?
That's a great question. As you know, right now, everything is kind of a constantly evolving situation. So we've been, actively monitoring and conferring with certain resources that we have to make sure that we're, keeping up with the most current recommendations. We've implemented recommended practices from various organizations like CDC, the American Dental Association, the American Medical Association, and our American Association of Oral and Maxillofacial Surgeons. We're only seeing emergent and urgent cases and conditions at this time, and we are actively screening these patients for a number of different protocols while using strict precautions when we do have to treat them, for their various conditions. Obviously OSHA, DHEC, CDC recommendations are being followed by all of our staff members, from our administrative staff at the front, to our surgical teams in the back, to include appropriate personal protection equipment, and modifications within the office. We are, currently, having patients wait outside of the waiting room area. So we're keeping that, that standard of social distancing, and implementing that in all of our facilities, so that we can kind of keep this kind of contained and still be able to provide these emergent services.
Well, it looks like you guys certainly are doing a great job. I see you have people waiting in their vehicles until it's their appointment time, but someone still might be a little hesitant if they think they have an emergency situation, but they're leery about going inside. I see that you offer virtual consultations. That's pretty neat. How does that work?
Well, it's kind of like what we're doing right now. We're trying to make the most of our online capabilities, and so online registration is a big thing that we're promoting right now. It's been there, but it's something that we've made easier and are trying to have our patients utilize that. And it gets down to the little things of handling paperwork and things like that. But the biggest thing, as you alluded to, is the telemedicine or the teleconsult capability. For patients that are still anxious about the process, we're able to offer these teleconsult capabilities. And so, by simply calling the office and requesting an appointment, we can set up a virtual consult. During that consult, you'll meet with one of our surgical assistants that can go over your health history and provide a basic screening for you. You'll also get to talk to one of our surgeons so that we can best ascertain, what the situation is, and if it's something that needs to be treated emergently, or if we can manage it palliatively with, medication or whatnot. So I think, by utilizing this, we can offer a lot of peace of mind for our patient population.
It still has to be hard though. If I say my tooth hurts, that one.
It is.
It's got to be difficult, but you're doing what you can. We thank you for that.
And I think, a lot of the healthcare providers in the area and whatnot have had to make these modifications and whatnot. So yeah, it's different, but we're doing the best we can and trying to provide that service for our patients or referrals in the community.
We are almost out of time, but I want to ask you, this last question is important. Like, what types of services again are emergent? What should people need to go in for, and what things do they maybe like wait out at home until this is over?
So really, like I alluded to in the first part, we are open to treat oral surgery related emergencies, and for us that constitutes things like acute dental abscesses with drainage, oral infections or facial infections that are related to an odontogenic or tooth related source, severe pericornitis, which is a condition of severe to moderate inflammation that's associated with impacted wisdom teeth. That can progress to an infection, advanced caries that will eventually, downgrade or basically, de-evolve into an infectious process. And then finally, trauma, whether it be the oral cavity or facial trauma.
All right, doctor, thank you so much for your time today. I know you guys have 6 locations in the Lowcountry, but at this point, it's just best to go to your website, which is charlestonorolandfacialsurgery.com. to get things, to start that virtual consultation, get things rolling, correct?
Got it.
All right, good seeing you. Stay safe. All right, bye-bye.